A hearty good afternoon and welcome to the session of Endometriosis and IVF. We are glad to have Dr. Suyash Bhandekar among us today to help us understand the topic. He will take us through that and more in this session today. Doctor, you have the stage.
Thank you so much for the introduction. I'm Dr. Suyash Bhandekar. I'm a consultant IVF at Apollo Fertility Center, Thane. Why I chose this topic is in the recent 1 or 2 months, I have seen plenty of patients with a low ovarian reserve, that is low AMH, and along with that, we had endometriosis also. So let's try to understand what is endometriosis and how to go ahead with that particular element. So endometriosis is basically a disorder where the endometrium, that is the lining of the uterus, the inner lining of the uterus, that is usually shed during the periods. It's not only inside the uterus, but that is found outside the uterus as well, like on the fallopian tubes, your ovaries, the peritoneum, or maybe on the intestine also. So that is endometriosis. So anywhere where the endometrial lining is outside the uterus is called as endometriosis. So we may have come across terms like endometriotic cyst or chocolate cyst. So these are all like a symptom or a presentation of endometriosis. So almost 30 to 50% of the girls may have endometriosis. And to be very honest, 50 to 60% of these girls have infertility problems as well. So, what are the symptoms of this endometriosis? The classical symptom is chronic pelvic pain or a cyclical pain that we talk about. So, that means just before your periods, you start having that pain, and that is a severe one. During the periods, also, it is severe. And once you're off your periods, after that time, it is slowly on decreasing side. So, this is like a typical cyclic pain that you have. Some girls have pain during their ovulation as well. So most of the girls they are fed in a thing कि, pain is normal during periods. Yes, it is normal, but if it is like a very severe pain and if you're getting it in like a cyclical manner, so before periods, during periods, even after period, it is still there. It is different, and you should get yourself evaluated. Second is pain having intercourse, that is dyspareunia, which is very commonly seen. People do take it for granted because most of them are told that yes, while intercourse, yes, it is painful, but it is not that painful. And after a certain time, when you're accustomed to having intercourse, the pain is not there. It should be a pleasurable act, not like a very painful thing. And people or girls try to avoid it. The reason is yes, you might have endometriosis. Third most common symptom is infertility. So, as I mentioned earlier, 50 to 60% of the girls are trying to conceive and not able to conceive, and once they are diagnosed, they come across this term as endometriosis. Fourth is they might have constant pain, pelvic pain that is always there, which is troublesome. It is like a slight of uncomfortable feeling that they always have. In case if the endometriosis is spread to the other organs like intestine or urinary bladder, you might have pain or burning during urination or bleeding as well, or while passing stools also. So if it is like an extended grade of endometriosis, in that case, your other organs are involved and the symptoms, the gravity of symptoms is also increased. So many of my patients do ask me, what is the cause for it? So actually speaking, there is no as such a pinpoint cause that is causing endometriosis. The most commonly accepted theory is yes, there is retrograde menstruation that is happening. So basically, the period, that is the endometrium, should get shed off from the uterus through the cervix and outside the vagina. So that is the normal course of flow that usually happens. But in case if there is some block or some resistance to the outside flow because of some XYZ reason, the period flow is not happening outside, it is going inside through the fallopian tubes outside the pelvic cavity. So that is the most common actually accepted theory, that is the retrograde menstruation. Sometimes it could be immunological effect. Uh, this is like just the theories I'm talking about. It could be some anatomic problem, like where you have a cervical stenosis, or you may have a septum, a vaginal septum, a complete septum, or a partial septum, or imperforate hymen. These girls may have endometriosis. Fourth is genetic. If your mom, your sister, or any of your directly related relatives have endometriosis, they may have it too. So these are all the possible causes that we usually talk about. But how do we diagnose it? There are multiple girls who say, yes, we are know of this particular endometriosis thing, but how would diagnose it? So, unlike fibroids, this particular element, the endometriosis, this disorder is having symptoms. And the classical symptom that we usually talk about is this uh, chronic pain, the pelvic pain, cyclic pain, the dyspareunia, by pain having intercourse, and infertility. So, this is the classical triad that we usually follow that gives us a clinical hint that yes, you may have diagnosis. Second, it could be a imaging technology, like you may undergo an ultrasound which shows you a endometrioma or a chocolate cyst or some sort of hydrosalpinx. So these are all radiological findings which can be seen on ultrasound. I especially advocate using a 3D ultrasound, which gives me a more precise dimensions and the extent of the endometriosis. Third, the gold standard is a laparoscopy. So there are multiple patients who undergo a hysterolaparoscopy for just like a diagnostic part for the infertility evaluation, and we come across this endometriosis. It could be grade 2, grade 3, grade 4 endometriosis, where the complete uh, pelvic region is plastered, which may involve your intestine, urinary bladder, the ovaries, fallopian tubes, everything. Or it could be just a milder element where it is just the endometrial spots that we come across. So the gold standard for diagnosis of endometriosis remains the hysterolaparoscopy. So, what is the treatment for it, and how do we go about it? Yes, we have confirmed that yes, this is endometriosis. So, what are the treatment options do I have? So it completely depends on the age of the patient, the severity of the symptoms, and the desire for conception, whether you want to have a pregnancy or you want to delay it. So, for example, if I have a young girl, just married or not married, and she's not desirous of having a pregnancy, so yes, I have array of medicines. The medical line of management is there, which can help you alleviate your symptoms. I can give you. We have multiple good medical line of treatment that is available now, which gives you a better symptom relief. But yes, in contrast to that, if I have a girl who is married, she's trying for a pregnancy, then yes, then I cannot give you this set of medications because those could be contraceptive in effect. So, depending upon the grade of your endometriosis, number one, a proper pelvic clearance of the endometriosis. Generally, we do it with a laparoscopy thing only. So, a good laparoscopic surgeon is going to clear your endometriosis. Followed by that, if it is like a mild or a moderate sort of endometriosis, then you may go ahead with a natural planning or an IUI. But in case if it is a grade 4 endometriosis where it is a complete plastered endometrium or your intestine, your fallopian tubes are completely damaged, in that case, we usually suggest you to go with an IVF. The reason is endometriosis is directly affecting your ovaries. It is going to decline your ovarian reserve. Your AMH is like going to fall drastically down. So with an IVF, yes, the possibility of conception is better. And yes, because if the fallopian tubes are blocked, then yes, obviously the natural or an IUI is not going to help you. So IVF remains the choice. Uh, I would like to recommend you three things, the three highlights of this session. Number one, if you are diagnosed with an endometriosis and you are looking for a pregnancy, please go ahead with a good endoscopic surgeon who's going to clear your endometriosis, pelvic clear endometriosis in a proper way. Because we have seen patients who have undergone a laparoscopy for the same and they have come with the recurrence within 3 months, 4 months. So that is somewhere not a good thing where we expect such recurrence very soon. Number two, even if you're going with an IVF, so the number of follicles that are seen and the number of eggs that are retrieved doesn't match. I mean, to be very precise, the egg quality is compromised. The reason is very simple. Endometriosis affect your ovary directly. So that is going to affect the egg quality also. So if I have 6 eggs out of six, I may get only 4 or 3 eggs at the max. I may not get all the 6 eggs because the egg quality will be compromised. Number three, there is almost 50% chances even after a laparoscopic clearance there is a chance of recurrence. So 50 to 60% of the cases land up in a recurrence. It might happen within 3 months, 6 months, 1 year, maybe after 2 years, maybe 3 years. So we usually suggest go for uh, a pregnancy as soon as possible. Get pregnant. Once you conceive, those 9 months of pregnancy followed by your period of lactation, so roughly around 1.5 to 2 years, will give you adequate suppression of this endometriosis. This is going to help you in terms of relief of your symptoms. Plus, yes, the lesions also decreases. They reduce in size and the severity. Yes, and obviously, even after some time, like maybe after 3 or 4 years, 5 years, if following the pregnancy, if you get a recurrence, we have a set of medication that is available. So without any surgery, without any other thing, we can help you with the help of medicines, maybe oral medicine, injectable. There is a array of medications that is available, which gives you a beautiful symptom relief. So with that, I would end my topic. Any queries related to this topic or your fertility related topic, I am most welcome. You can call me anytime. I will be able to answer your questions. Thank you so much.